All right, welcome back everybody to another edition of Triplane Function. It's been a while where we take a muscle so you can see it, feel it, move it, and teach it. Last video we worked on this extensor mechanism in the forearm here, that lateral epicondylitis, that tennis elbow. This video is going to be very similar, but we're actually going to be working on this flexor side. There's quite a few muscles. Like I said in the extensor video, we're just going to refer to this as the common flexor wad. If you're really curious about what specific muscles attach here, please go grab a netter, Google it on anatomy. We don't want to go through every single one. You're going to get the same kind of a effective stretch here, just doing this triplane stretch. To mimic what happens with the reason why these flexors get so tight, we refer to it as golfer's elbow or medial epicondylitis. There's the wrist flexors, and to have Joey demonstrate, we'll take that TheraBand at home, want you to tie a loop in it, and remember the goal of all these videos is to give you just a visual aid with this TheraBand. It's not an exercise, it's just to give you an appreciation for how that muscle is elongating and shortening, or what we say eccentric and concentric. So Joe, I'm going to have you slide this up to your medial epicondyle. So if you're following along at home, if you want to use the TheraBand, awesome. If not, that's okay too. You just want to find that stretch. So Joey placed this knot right over his medial epicondyle, which is where that common flexor wad is. There's multiple tendons in here that flex this wrist, and they also, some flex the fingers. The finger flexors are more down here, but that's all right. You can bring it down, put it in between the finger, put it in between your thumb. So what we'll see is when he extends, see how this is lengthening here. I hope you can see it in the camera. If you're following along at home, I hope you can see it. It's lengthening. Now, if he actually flexes, real loosey-goosey, okay? A lot of movement there. So people, if you're having pain over here, you're having pain in this forearm, maybe even in the fingers and wrist, this is going to be a great stretch for you, okay? A lot of times in the clinic, like I said on the extensor video, we give these things called Nirschl stretches. Dr. Nirschl, we love you for giving us these stretches, but hey, we can add it, we can triplanize that, we can make it all three planes of motion. So I'm going to have Joey, we're going to have him weight bear again, just like we did in the last video. This is going to be great. If it's a true soft tissue injury, if you have somebody you're treating in the clinic and they're just coming out of that cast or they're coming out of that splint from like a wrist fracture, we know after an injury, everything gets very short and tight around a joint, right? So fracture, I would not start weight bearing. We'll go over what it would look like against the wall soon, okay? So here he is, he's down here. This is nice and tight for me. 3 planes of motion. We know we love to use that arm driver when he's here, okay? So Joe, let's take us into that transverse plane of motion here. And you can tell the people you're feeling more of a stretch.
More of a stretch. As I go this way.
As you go that way? Okay, as you reach back towards me?
Yep.
Excellent. It's transverse plane. Joe, where are we going to go next?
Sagittal plane.
Sagittal plane. There we go. How's that?
Good. Better as I go overhead.
Overhead, you're feeling more of a stretch. Okay, awesome. All right, Joe, only one left. Frontal. Not going to mess up in this video. Messed up last time if you were watching. How's that?
Good.
Good. More of a stretch?
Yeah, more of a stretch as I side bend to the right.
Side bend to the right? Okay. Excellent. What if you bring this arm behind and go more like that? Add to keep those hips out and then come up. There? Or just more there? Some more coming up, kicking away?
Yeah, more up to the right.
Okay, excellent.
Actually, yeah, both.
Both? Okay. All right. Just something I wanted to try there. Joe, he was bringing his arm up over here, but he was also bending away and bringing it back here. So he was getting a stretch at both end ranges there. Something you might want to try at home. So again, Joe said he was really feeling, would you say most of the transverse plane?
Yeah.
So transverse plane, when he was reaching back. So if you notice, his hand is just flat down, just like this. So what if we want to get a little bit more of a stretch? Be careful with this. Listen to your body. Remember, you are the expert. You know where these tight corners are. If you're down here weight bearing like that and you're saying, hey, that's enough, I don't have time to use these arm drivers, do 3 planes, start there. Eventually you're gonna get into that plane of motion eventually if you keep working this. So if I have him turn just a little bit, not too much, where he can tolerate it, are you feeling more of a stretch just weight bearing there?
Yeah.
So he's feeling it already without using an arm driver in those 3 planes of motion. If he went transverse now, I bet you feel a lot more, right?
Yep, a lot more.
Now, if you're just that yogi, like Andrew and I always say, you're just somebody who just, hey, I'm not feeling it here, I'm not feeling it here, you can play around. You're the expert. You can combine these planes. So let's combine some of these, Joe, for the people at home. Let's have you go transverse, reaching back. But now what's happening? He's going to kick. You guys can't see. He's going to kick that hip out and reach back. So he's going to do frontal. How's that?
Yep, even better.
Even better? And what if you bring that arm back? We get that sagittal. How's that? Really feeling that?
Yep.
How's that face looking, everybody? Pain face?
Pain face.
All right, excellent. Remember, we always don't want you to have a pain face. We want you to be where you can tolerate it. We just do it for fun here. Now, if you're somebody treating someone post-surgical, like a distal radius fracture, we know everything gets tight. Short goes into protective mode, right? I would never ask that patient to weight bear. What's going to happen? The patient's going to go to the doctor and say, hey, they're having me try to do this. They're a couple weeks out. Doctor's not going to be happy. So what can we do? We can start against the wall. Okay? So Joe's going to show you how you can do the same thing against the wall. But you incorporate that lower body as well. So Joe, let's start with that transverse plane of motion. So hopefully you can see this at home. I'll move this bench. But Joe is also stepping away, opening up that hip. Stepping with that leg, using both. How's that? Feeling? Give you a stretch there?
Yep.
Excellent. Perfect. Let's go sagittal, Joe. Excellent. How's that?
Good.
More overhead?
Yeah.
Okay. What about if you take your arm at it? And we just have you re-drive with the leg. Feeling more there?
Yeah, more.
Yep, perfect. Still feeling it there. Don't even need the arm. Last one, let's do frontal. Good. Good, kicking the hips. Let's have you face this way, Joe, so that people can see at home frontal. Just so you can see what's happening with his hips here. There you go. Yep. Excellent. And he takes his arm out. Still using those hips, still going like this. I like it. All right, Joe, you can relax. So if you're somebody, who's just having a lot of medial elbow pain, some wrist pain here, I would really recommend trying this. Remember that diagnosis is going to be medial epicondylitis or golfer's elbow, okay? So take these Nirschls, Triplane them, try them at home. You're the expert, remember. Thanks for tuning in and be on the lookout for more videos, all right?